Yeah, good afternoon, our viewers. Good morning and good evening from wherever you are watching us around the world. We are here again on Opinion Sharers platform to actually discuss topical, national, continental, and global issues. Today we'll be discussing about something very important, but before we go, I'm Olaogun Michael Sukomi by name. So today is very important, and of course we'll be doing the cross-examination of President Muhammadu Buhari's medical trip to the United Kingdom. And of course, this is not new to us as Nigerian. Vis-a-vis the Nigerian health sector, looking at how the state of things in Nigerian health sector. If we may know, Nigeria health sector is one of the, shall I say, challenging one across the world, where things are seemingly not working. Doctors are on strike, nurses on strike almost all the time. And the way the political class do respond to the demands of the medical practitioners somewhat begs for serious concern or questioning. And of course, we cannot shy our eyes away from some of these things. So today we'll be doing a whole lot of discussion. We have experts in the house that will be opening our eyes to some of these things. This afternoon we have Dr. Lars Ude Eze. He is a health policy and management specialist, a sustainable development consultant, and founder and CEO of Talk 8 Real Media. Is a convener of Make Our Hospital Work. He's a Nigerian health practitioner, and of course, we salute all he's been doing. We equally have Mr. Fadu Mopor joining us all the way from Kerala in India. He's a social worker, and of course, he has continually rendered his opinion on issues as it relates to our nation, our continent, and of course, the global environment. So we are still expecting one more guest. We hope he joins us anytime from now. So Nigeria's health sector is one of the very sick sector in Nigeria. I've been privileged to have moved around primary healthcare facilities, secondary healthcare facilities, and of course, the tertiary healthcare facilities. It won't be wrong for me to say they are somewhat nothing to write home about. However, we give kudos to the ones that are with exception, but very few. This afternoon, I think it is very important for us to actually render our opinion, uh, basically to make our nation get better or to wake up from our slumber. So our president is in the United Kingdom. Of course, he's no stranger to that system. He continues to travel almost all the time. Sometimes he has traveled for over 90 days, sometimes less than 90 days. Now, last week, he wrote to, his spokespersons made us realize, understand that the president would be traveling to the United Kingdom again for routine medical checkup, leaving over 200 million of us to actually seek for health treatment, perhaps out of pocket, depending on the level of affordability. And medical tourism, as we know as well, is not something that is strange to the elites in Nigeria, particularly the political class. They continue to take advantage of our Commonwealth to actually get treatment abroad. Some of them go to United Kingdom, America, Dubai, India, and what other countries as we may know. But this afternoon, let me just ask Dr. Lars. Dr. Lars, what do you make of the frequent trip of President Muhammadu Buhari to United Kingdom for routine medical checkup?
Thank you very much, Michael. Like you said during the intro, that is not new. It's something that the country has been used to since Mr. President assumed office as the president of the country. But we can't stop talking about it because it's something that is abnormal. Whether it's the current president or the people before him, or even the ones that will come after him, uh, we shouldn't get used to having a health sector that is too weak to treat our president. Because what that means is if the president or any other public officer has a dire emergency, that is life threatening, and we don't have a system that is strong enough to take care of the president, it means that we are at risk of losing such person. So our health sector working, our hospitals working, Nigerian health system being strong is in the interest of all of us, in the interest of the leadership class, in the interest of the followers. So it's disappointing that at a time that resident doctors are on strike all through the country, at a period that Nigerians' access to healthcare has been significantly diminished, at a period that many persons were in hospitals, government hospitals that are usually relatively more affordable, they'll be forced to perhaps go to more expensive private hospitals. Some may have to sell some of their belongings, some may have to incur debts, due to higher fees they are likely to pay in private hospitals, and some may even have to lose their lives, unfortunately, because not in Nigeria, the teaching hospitals are actually more equipped than many of the private health facilities around. So some may not be able to find a private health facility that have the capacity to manage their health condition. Even those that have equipment may not actually have the manpower to have that appropriately used. So that's the period that our president is in another country that made their hospital to work, made their health system to work, probably using our common wealth, using our resources and taxpayers' money to take care of himself, while the rest of the Nigerians are left on their own, to probably die from their illness where they cannot afford to treat themselves due to the impact of COVID-19 on our healthcare, as well as the ongoing strike action by resident doctors across the country. I feel ashamed of it, and I believe every other citizen will not probably be comfortable with this situation.
Thank you, Dr. Lars, for actually laying the foundation for this discussion. Now to Mr. Paul. I know you have always advocated for better Nigeria despite being out of the country. You have always rendered your opinion, and I think that's one of the reasons why this platform was created. Now, as a strong critic of this administration, what do you make of President Muhammadu Buhari's visit to the United Kingdom again for routine medical checkup?
Okay, thank you, Michael. As usual, I think I'm no longer surprised by President Buhari's behavior. And simple, I would say he doesn't care. I used to think maybe they don't know. I used to think maybe it's ignorance. But really, at this point, I think President Buhari and many of the Nigerian political elites don't just care. They know that Nigerians cannot do anything. They know that even if you make noise, like we are doing this discussion, that's all. Nothing is going to happen to them. They don't suffer consequences as a result of this. So they don't care. They can dare us. You see some of them, people in their class will still win election come 2023. And so from my own observation, I think people like President Buhari don't just care about what happens to us, because he is a man that has said something and would do something else. I shared something on my Facebook yesterday, and I went back later to take a look at it. I shared it 6 years ago. I wrote it 6 years ago, and what I wrote was that President Buhari's honesty brought him back to power 20 or 25 years after. And how wrong I was to have written that in Dubai 6 years ago. Because unfortunately, it is clear now that I was wrong, that I think that I thought President Buhari has integrity. In fact, I thought maybe it was the integrity that gave him power the second chance or the second time. But how wrong I was, and many millions of Nigerians were wrong, or maybe we were deliberately deceived into believing that this Buhari is a demigod, is so holy, he would never, practice anything like that we are currently seeing, which is flying on our back to UK to enjoy the medical facilities that people like us, people who doesn't have two heads, people who probably doesn't even have the kind of resources that we have, human and material. Yet that's where he is now. That's our reality. Thank you, Michael.
Wow. Thank you so much. The conversation is getting hotter and hotter. Dr. Lars, I'm coming back to you. According to reports in 2019, we're made to understand that the Aso Rock Clinic alone has gobbled as much as 9.17 billion naira. This is a very humongous amount of money that I believe that if injected to tertiary health facilities across the geopolitical zones in the country, maybe one across the 6 geopolitical zones, this would have perhaps to a very significant extent contributed to the development of some of these health facilities. Now, in your own opinion, is 9.17 billion not too much for it to have been allocated to the Aso Rock Clinic alone, putting into consideration our population as high as over 200 million? What do you make of that?
Well, over 9 billion naira. One thing is health is expensive. Healthcare expenditure is usually on the high side. I do not have enough details to say whether it's too much, whether it's appropriate or otherwise. But my own concern is that the ASO clinic is not good enough for our president. My prayer, my wish would have been, irrespective of the money they spent, for that place to be good enough for our president. Because the cost of Mr. President traveling out of the country is humongous. The presidential fleet and all the persons that have to go with him, spending 2 weeks, if you get the details of that cost, is something that probably, if given to used to sort out the issue with the resident doctors, probably they will not be on strike. So I want the ASO Rock Clinic, I want National Hospital Abuja, I want any other healthcare facility, at least, if nothing else, let the president of Nigeria have the ASO clinic that is good enough, functional enough to treat our president. That's my wish. So are we getting value for money? We have to do some level of study and analysis to know whether we're getting value for money or not. So as a health finance person, I wouldn't speak just based on speculations, whether the money is big or not. I would have wished that we get a result, the outcome being that the president would never have to travel out again for medical care, except he becomes a private citizen. Of course, any individual can go anywhere to seek health care. We can't stop anybody. But for public officers who are using our collective wealth for these expenses and who also have the primary responsibility to making our hospital to work, or at the minimum, creating an enabling environment for private sector to thrive in the health sector. If we have the enabling, because many of these hospitals that our politicians go outside the country are not even owned by the government in those places. Many of them are private sector, private hospitals. So let Nigeria, we have the number, we have people that have the money. We spend billions of naira. It's estimated that we spend over $1 billion on medical tourism. Nigerians, not just government, but even private individuals, who are seeking better health care. Let government of Nigeria, our brother Paul is in India. India is a hub for medical tourism, and Nigerians love India when it comes to medical tourism. And most of those hospitals they go to in India are not owned by the government of India. They are private hospitals. So let's also make our environment conducive for investors, whether they are Nigerians or not, to bring their money and establish those world-class hospitals, so that even if our president don't trust Aso Rock Clinic or any government hospital, let him be able to trust a private hospital in Nigeria to treat him, and let other Nigerians also spend their money here in Nigeria seeking healthcare, especially those that have those monies to spend. That's what I would like to see. And beyond Mr. President, health is everyone's responsibility. Governors have huge roles to play, local government chairmen. We as citizens have to be active citizens and hold them accountable while playing our own part.
Yeah, thank you so much for that submission. I think now, before I come back to you, Dr. Lars, let me throw this question to Mr. Paul. Before you, I know you used to be with us here in Nigeria before you left for UAE and from UAE to India. You have experienced the medical health service delivery both in 3 countries, if I'm correct. What do you make, or what difference is observable in what we have here and what we have in UAE and India put together?
Okay, Michael, thank you. To be honest, and really, I love Nigeria. I do say I'm among those Nigerians who believe that it is in Nigeria that if you make money, if you have money, that you can enjoy it, that you can flex it. So I am a Nigerian with the whole of my heart. But the truth is that the health sector in the UAE cannot be compared with what you have in Nigeria. It cannot be compared, neither can you compare it with what you have in India. You see, recently, about maybe during that COVID lockdown, a friend of mine who is based in the US contacted me and said if his friend wanted to come to India, is contemplating coming to India for IVF, that I should help him and look for a good hospital and all of that. I was still in the north then. So, and I told him, see, when you go out to the street, you don't need to look for IVF hospital. There are lots of them on the street. On one street alone, you can see multiples of hospitals that can completely do that for you. I spoke with one of my professors, and she told me that whenever the person is coming, that they were, it doesn't, you don't even need to book so much ahead because it is available. I have also enjoyed that in Abu Dhabi. When I was in Abu Dhabi, it's just the first time that we have to stay in a hospital. I told my wife, we are done. How are we going to be able to pay for this? Because the room of the hospital was like a 5-star hotel. And I'm being honest. You understand? But a dime we did not pay because we have health insurance. In fact, 1 dirhams we did not pay. They served us food, according to. So it's just because I was also under the national health insurance when I was in Nigeria, when I was working as a civil servant. So I know the difference. I know the difference when I go to the hospital in Nigeria and when I go to the hospital in this place. It's nothing to be compared with. I think the reason why some Nigerians are not angry is because either they can afford it to go abroad. All right, if you can afford to go abroad, so I don't worry. Or they can afford the best private hospitals in Nigeria. Or they don't know what they are missing. Because when you don't know what you are missing, whatever is presented to you, you think you manage it, that you can make do with it. But the truth is that you cannot imagine the amount of Nigerians that has diabetes without knowing. You cannot imagine the number of Nigerians that has high blood pressure without noticing, without knowing, because they don't do testing. A lot of us are educated illiterate, and pardon my language, but that's just the truth. These are small things that a little bit of education will help you out. A little bit of patronizing hospitals and the health sectors that have things available will help you sort out. Anyway.
Yeah, thank you so much. I know you are becoming very emotional about the state of things in our country. Of course, an average Nigerian at this particular time is bound to behave or react in such a manner. Dr. Lars, you have always advocated for better health institution in the country. You continue to use your network. You continue to use every opportunity. You continue to use every platform to advocate for better health service delivery in Nigeria, making our hospital work. And of course, through your show, you have always rendered your opinion criticizing government on what's needed to be done for us to achieve a better service delivery. Doctor, what is the state of our health institution, or rather, holistically, what is the state of health service in Nigeria, and what led to this deficiency that we are experiencing?
Thank you very much, Michael. Our health sector trying to diagnose what the problem is. There are 6 building blocks of the health sector, and each of them have to be strong for the health sector to be strong. Let me quickly go through those 6 building blocks. You have human resource for health, which is, to me, is the most important. The health workers themselves, and health workers are not just the doctors, nurses, dentists, physiotherapists, community health extension workers, or midwives, or all of that, or pharmacists. It's not just those ones. It also includes cleaners. It also includes those that man the generator house in the hospitals. It also includes the accountants. It also includes the admin person. It also includes the security personnel within the healthcare facility. So their welfare, their work environment has a lot to do to determine how the health sector will operate, because the human resource for health are the ones that control and manage all the other resources within the sector. Number 2, you have governance and leadership. The leadership and governance speaks to the various authorities within the healthcare facility and also at the community level. From the communities, you have the Village Development Committee, the World Development Committee, which is part of the World Health System created by the National Health Act in 2014. These structures, are the custodians that should provide leadership and governance for primary health care. This is almost absent because the community people are not really playing that part. Every primary healthcare center in this country knows that primary healthcare is not the same as primary healthcare center. Primary healthcare center is the facility, is the building, where people go into to receive care. But primary healthcare system in itself includes both the community and the facility itself. So if you take away the community, then the primary healthcare system is incomplete. And the community, there's health education that should happen at the community level. There's community mobilization, community participation in primary healthcare. If it's absent, then it cannot be complete. So by that, there should be a facility management committee which is headed by the village chairman, and they are the ones that meet periodically, at least once in a quarter or in a month, to make policies and ensure that existing policies are applying. So leadership and governance is key, and it involves communities. I'm laying that emphasis because many times when we talk leadership and governance, people begin to think only of President Buhari, the governors, and perhaps national and state assembly members and local government chairmen. But it includes unelected persons who are community leaders at various levels. Then number 3 is medical products. The medical products involves the supply chain management, it involves drugs, it involves vaccines and all that. Medical products, vaccines and supplies, it involves consumables. Their production is very important, and after production you go into consumption. So production of this medical products, over 70% of drugs we use in Nigeria are brought in from outside Nigeria, and this is a huge problem because it means that when we have emergency, like in the period of COVID-19 where everywhere got locked down, we were stranded. Thanks to God that the COVID is not killing here as much as it's killing elsewhere. If not, it would have been a major disaster. But that's not to say that over 2,000 lives that we've lost to COVID is small. It's a lot, But imagine where we have a medical emergency that we require drugs and others are taking care of themselves, and say like what we are having now, the vaccine inequity, where over 70% of COVID-19 vaccines have been administered to over 50 million persons, were just administered in 10 countries of the world. So Africa with over 50 countries had, we are just starting with a very small number that COVAX, we are depending on donation to even start vaccinating our people. So medicines, vaccines, and other medical products, the manufacturing is key, apart from just looking at the supply chain management from bringing it from outside. We have to provide enabling environment to manufacture them locally through funding research, from research before you produce, and also having the all the factors of production in place to make it easier to produce. So this is really key. It's not only good for the healthcare, it's also good for our economy. India is manufacturing most of their stuff and sending out to other countries. Bangladesh is doing the same. In the early 80s, Bangladesh was almost like us, but they made certain policies, prioritize it, and now they're even exporting medical products to more than 100 countries of the world. We can do the same because we have similar population with countries like Bangladesh, Pakistan, and all of that. Number 4 is health information management system, which speaks majorly about data, medical data. So if we have good data, good quality data, we make our decisions based on those data. Technology has even made it easier these days to have electronic medical reports or electronic medical information, gathering data. And we really need to take this serious because it's garbage in, garbage out. If you don't have quality data, it affects every other aspect of the healthcare sector. 5 is healthcare financing. Healthcare financing has to do with how do we fund healthcare? How do we, not just funding hospitals and all that, but also affording care. Issues around health insurance, universal health coverage, things that are covered. Right now, over 70% of our healthcare expenditure is out of pocket. You and I going to a hospital or a pharmacy and paying out of pocket. And it's not sustainable. Less than 1% of Nigerians have any form of health insurance. That's, we have over 180 million persons not having any form of health insurance. Even in advanced countries like in the US, the current cost of bankruptcy is catastrophic health expenditure, where people have to pay out of pocket for healthcare. So it's something that we must find solution. Already we are spending a lot of money on health, rich or poor. Everybody spends significant proportion of their earnings on health. So the good news is we have state health insurance scheme agencies. Many of them has been enacted over the last 2-3 years, but governors need to make it work, and Nigerians need to begin to, those who can afford it, to buy health insurance, because you actually spend less when we have a pool of funds. Then lastly, number 6 is service delivery. Service delivery speaks to the quality of service we get when we seek either preventive, curative, or palliative care in the health sector. So, and all the other factors play together, from the human resource, from the availability of medical products, from the leadership and governance, and the health data management, and the financing, to determine the quality of healthcare service. Of course, we all know that if our healthcare service, the quality of service is top notch, perhaps our president will not be in the UK right now receiving healthcare. So, but it's also a primary responsibility of Mr. President, the governors, and all of us as Nigerians to make sure that we get that quality healthcare. And as citizens, we must keep demanding and insisting that the president of Nigeria should not be going outside Nigeria to receive healthcare. It's something that is shameful, and it's something that no leader, even the governors should not be proud of. Let the president get the ASO clinic to be good enough for him to seek healthcare, and let the governors also get all those their state-of-the-art hospitals. They keep cutting tape every now and then, So let it be good enough for them to also seek healthcare without having to travel outside their state. It's unfortunate that a former governor of Oyo State, died reportedly died from COVID-19, receiving treatment from a hospital outside Oyo State, where he was governor for 8 years. So governors should make sure it happens in their state. Let there be a hospital, whether it's government or private, that should be good enough to take care of them, for them to use and get healthcare. So looking at these building blocks, you agree with me that we are not doing well in any of them. Doctors are on strike. Maybe tomorrow it could be other set of healthcare workers, which means the human resource, they are not happy. If they are not happy, even if other ones are standard, if you have all the equipment, if you have every other thing, if the human resources are not happy, then anybody that is not happy cannot give you a satisfactory quality of health service delivery.
Wow. Thank you so much. You have taken your time to actually educate our minds now on the levels of should I say, delivery. Yeah, let me use that language. Now I'm better informed, I'm better educated. Now, to Paul, Mr. Paul. Of course, we know policy determines the life, the success, or the failure of any society. Before I go back to Dr. Lars, in terms of policy implementation, I would want us to compare Nigeria with India. What do you make of the policy implementation in terms of health delivery, judging from your experience in India, UAE, and of course, Nigeria?
Well, it's like you're giving me a tough job to do. Because the truth is that I don't think we really can compare them. Honestly, because take for instance in UAE, it is government that, even though there are a lot of the hospitals in Abu Dhabi or in UAE generally is private. Okay, and there are a lot of Nigerians who can afford it, comes to Nigeria, I mean comes to UAE, whether Abu Dhabi or Dubai or Sharjah, to get healthcare. But the truth is that government have so much influence on those hospitals. Okay, and everyone that is legally living in the UAE must have health insurance. It is part of your ID card. You cannot have ID card, a UAE Emirate ID card, without a health insurance. I have an health insurance until I came to UAE. I mean to India. All right. So only even the last time I wanted to visit, I had to also buy health insurance to be able to go visit my wife just on a 30-day visa. I had to get health insurance. So I think when you talk about policy, it has to be deliberate. Like these things that Dr. Laz has just itemized. These are things that happens in a very structured, I mean, well-structured environment. And it doesn't happen by accident. It happens, these are things that you see abroad and you think, these people they've been doing it for 100 years. I think it's just been systematic. It's just taking a decision. He also make an example of India, Bangladesh. They started somewhere. Okay? One thing that I've noticed about India is that they domesticate their policies. Okay, including their dressing, including their way of life, their style of everything is domesticated. All right. So as much as I think it's okay, like globalization, I've studied globalization, and I think globalization has worked for a lot for China and India. But I think we can also learn from it. Let us go and copy. We don't have. It doesn't have to be original. Like China started copying, and today they are on top of the world, supplying virtually everything that you need. So let us also copy. We have Nigerians who are professionals. We have people like Dr. Laz who can sit down and draft something for people in the National Assembly at the level of policy. But I think it's not, we don't lack professionals. We don't lack people who have knowledge, But I think we lack the will to actually do things for the people. That's perhaps what we lack. Because we can speak English. A lot of us, a lot of Nigerians are very brilliant people. But then you wonder, why is it that these things are not working? Why is it that we can't make things work? In the UAE, honestly, you cannot compare. Or in India, I've lived in India. I didn't get health insurance when I came to India, and the first time I was going to go to the hospital, it was easy. It was easy. It was available. The government hospitals here in India are so big and very cheap. The only thing is that you have to queue, because all the poor people come to the government hospital. So you will see a lot of people, you will meet a lot of people. But the private hospitals are also busy, but not as busy as the government hospital. And they're also, relatively affordable. Not all Indians have health insurance, but majority of them has. But in the UAE, everybody, as a matter of government policy, everybody who has an Emirate ID has an health insurance. I think we should go that way.
Wow, thank you so much. Thank you. Dr. Laz, let me come back to you. I think the discussion is getting intensified. Are you of the opinion that we also should copy and paste in terms of policy formulation and implementation? Because one thing I've discovered these days, I would love to talk from the angle of democracy now. The disadvantage about copying and paste is just that we overcopy to our own detriment, not putting into consideration our cultural, our religious, social, and all sorts of differences. Do you agree that we copy and paste? That's question number one. And then the last, my second question to you is this. I know you have been engaging policy actors. You have been engaging, institutions of government, whether the executive, the legislative institution, and all because you want better on quality ed delivery for Nigerians. What do you make of the responsiveness of our political elites, of our civil servants? I mean, when I say civil servants now, I mean those at the very top echelon. What do you make of their level of responsiveness to the desired change needed in our health industry?
Thank you very much. Yeah, talking about policy, my area of specialization, my postgraduate study is actually on health policy and management, and I've been actively involved in the, almost a decade in health policy development in Nigeria, following through a number of health laws or public health laws that have been enacted, especially at the federal level. Yes, I wouldn't say copy and paste, but I think perhaps what Paul meant to say could be, yes, if we see something that is going well somewhere, we can also adapt it and make it work for us, but we have to make it work, taking into consideration the local context, the culture, our own governance structure as well, and many other things. And I must say that in terms of health policies, we have some of the best health policies in the world. Some other countries come here, take up our policy documents, and go to their country, adapt it, and begin to implement. Years after, our officials here will shamelessly start traveling there to study how they've made the progress they've made, and those ones will be bewildered, saying, what the heck, how could these guys who we took their policies be coming here to learn how we did it? So I think the problem with Nigeria is not policies. If you go to the Federal Ministry of Health and indeed many other uh, agencies of government or ministry, you see very beautiful policy documents that if we implement just 50% of it, in accordance with the intention of those documents, we will not be where we are. So it's more of a problem of implementation. than that of that doesn't mean that we don't need better policies. Of course, it's a dynamic world. We keep modeling, changing, amending to adapt to current realities, or even in future adapt to certain realities. But we have the national health policy. I think the last update was around 2016. We have the National Health Act 2014, which provides a policy framework for the health governance in the country. And in the National Health Act, there are, so many provisions of it that is yet to be implemented. For instance, there's a section that talks about standards, that every healthcare establishment must have a certificate of standard within 2 years of the National Health Act. So we are more than 6 years of the enactment of the National Health Act, and there's no single health facility in the country that have the certificate of standards. So this aspect is not being implemented. Even the Section 11 of the Act on Basic Healthcare Provision Fund, uh, it was the act was enacted in 2014, and the first time a budget was made for the Basic Healthcare Provision Fund was in 2018, 4 years after the act came to being. And the first release that was made in May 2019. 24% of the 55 billion naira that was appropriated in 2018 was released in May 2019. The second tranche of release was actually made last year. So out of 166 billion naira that has been appropriated as basic healthcare provision fund between 2018 and 2021, only about 50% of the 2018 budget, less than 30 billion naira, has been released. So that's unbelievable. And even the one that has been released has not even been fully utilized. This is just crazy. And this is the law that is meant to make more money available, at least 1% of consolidated revenue fund of the federal government, to be used to support the states in making primary health care to work. Support the state, not the world, not to replace. It's not a replacement fund. The states and the local government still have a responsibility to make the primary health care in their place to work. This is just an additional fund. But what's happening today is some states just take the money and say, oh, no, this is not enough. And these monies are to send directly to health centers, at least one per ward, to make one healthcare facility per ward to be functional. You see, in some places, you're already getting reports of the community leaders, putting pressure on healthcare facility in charge for them to withdraw because the signatories to the account where the money goes to, you have the World Development Committee chairman and the officer in charge of the health facility. So they are the signatories to the account, and this money is to go directly to the health facility for them to use fixed infrastructure, perhaps hire some additional hands and anything that they need to make their health facility to be functional, to use that money and make it happen. But already people are trying to share the money as a national cake, without using it. And we have credible reports to that effect, where some communities are already, putting pressure on the health workers for them to withdraw the money and share among those they call stakeholders. A well-intended policy, but implementation still ends the way of corruption. And so much money will be spent, and you not get value for money. No significant improvement has been made. So I think the more people know about these policies and begin to hold the people, the leadership account, and by leadership, it might surprise people to know when it comes to healthcare, federal government has the list of the job to do. You understand? The job of federal government is more of policy, health policy, which to a reasonable extent they are doing. Another aspect is monitoring and evaluation. The health facilities that the federal government have direct control over are the federal university teaching hospitals, the federal medical centers, federal neuropsychiatry hospitals, federal eye, ear hospitals, and all those federal hospitals, which are just about 100 or a little above 100 of them. Those are the ones federal government have direct control over. The rest are under the control of the states. So the governors have control of the rest, whether it's public or private. Why do I say so? It's the state government that give you a license before you can establish a private hospital. It's not the federal government, except if you are putting it in FCT, Abuja, where the Federal Capital Administration will be the one to give you license. But outside there, anywhere else, no matter how big or small the hospital will be, it's the state government that will give you license. And it's also the state government that will say you are not running this hospital well. You are not, you private hospital, you are not doing well. So I'm withdrawing this license I've given you. So we need to hold the governors more accountable, hold the commissioners for health more accountable, and hold the local government system more accountable in terms of educating the people about health. There's so much health illiteracy. You see a professor of a particular area, when it comes to health, you will go and meet a quack that will tell you you have typhoid and malaria. Meanwhile, what the person has is a common flu. It's not even malaria. It's not even a bacterial infection. It's a common flu that even if you don't take anything, it will disappear within days. You may just have to stay and eat balanced diet and have some rest, and you get better. But you see a professor that will go and meet one quack somewhere, and they will be injecting the person anti-malaria drug and give the person a drug supposedly for typhoid to take for 2 weeks. It's a heck of a shit, if I must use that language. But solving this problem is every one of us, and that's why we started the Make Our Hospital Work campaign. Let the citizens get educated and take individual actions to make our hospital to work.
Wow. Thank you so much, Doctor. I think I can't belabor you with much questions. You have actually opened our eyes to some of the issues in the health sector. But there's something I would really love you to dwell much on, which is the level of responsiveness of our actors to health advocacy in terms of delivering quality health service for Nigerians. You have always engaged National Assembly. You have always engaged the top echelon of institution of government. What is the level of responsiveness? We want to know whether we are only talking or we are only doing the talking and concurrently walking the talk. What do you make of that?
Michael, you're asking me a question that we all know the answers, right? We know the answers in terms of level of responsiveness. If a critical mass, even if it's 50% of the key players that have role to play in the health sector are responsive, we'll definitely not be where we are. But that's also not to say that we've not made progress. We must acknowledge that we've made some good progress in the last decade. In the last couple, 20 years, there's been good progress, pockets of progress here and there in some areas. In terms of malaria fights, we have less number of persons dying from malaria in 2020 than we used to have like in the year 2000. Of course, so many persons still die from malaria, especially children under the age of 5. But we've made some progress in terms of policies. But I must note that a lot of this money is from foreign donor funds, so if those funds stop coming, we may probably go back to square one. In terms of responding to health emergencies, I think the establishment of NCDC is a game changer because there are many things that we take for granted now that was totally absent in the last 10 years. Now we hear more about Lassa fever outbreak. We hear more about different outbreaks, even before COVID-19 came. Lassa fever has been with us since the 60s. I think the first case was discovered around 68, 70. Here in Nigeria, the first case was discovered in Lassa town or Lassa village in Borno State. So it's even a Nigerian virus. And it kills people, and sometimes they say it's spirit and they give it other meanings. But at least in year 2021, Nigeria now has a better capacity to identify those cases, to even diagnose them. There are many more laboratories now. Thanks to COVID, that in the last 1 year, we've been able to have over 100 laboratories, and in fact, more than 70 molecular laboratories from just 4 in March last year, we have over 70 molecular laboratories now that can diagnose not just COVID-19, but also Lassa fever and some other viral infections. In 2014, we were taking samples to Senegal to diagnose Ebola, in 2014, just 7 years ago. But right now, we can diagnose Ebola in Nigeria. So that's progress. And we must give credit to Nigeria Center for Disease Control, Federal Ministry of Health, and development partners, and everybody that helped to make this possible. HIV/AIDS, we've also made huge progress. It's no longer a death sentence. Many persons are on treatment. There's much more to be done. Many of the funds are still from foreign donor funds, but we've also acknowledged that the health workers who are doing the job are mostly employed by the federal government and state governments of Nigeria. So that's also more like our own contribution. So we need to devise a sustainable means of funding these things, so that if the donors decide to take away their resources, we will not get stranded. On family planning, we've also made marginal progress in terms of contraceptive prevalence rate. In terms of, it's like in every 5 years, we just have 2%, 2 additional percent of people who are using contraception in Nigeria. The progress is very slow. There's so much more to do, but we must acknowledge that compared to 1990, where the contraceptive prevalence rate was about 7%, right now is about 17%. Very far from where we are supposed to be, very far from our own targets as a country that we set on our national policies. But it's still some progress. So despite these pockets of progress here and there, the conclusion is we are still in a very terrible situation. Yes, we could say that maybe someone who was scoring 7% in exam before is now scoring 35%. But even at that, the person is still below the pass mark. So our health sector is still in a very terrible state, and the key actors that will make it work are more of the state governors, because the actions are the states. Primary healthcare, you now have agencies, primary healthcare development agencies, which is the governor that appoints the executive secretary, of such agency under the primary healthcare under one roof. The governors have marked the local governments. They are the ones that determine who the local government chairman will be, through both whether it's appointment or by the so-called elections. So it's only whichever party that has the governor that wins 99.999, if not 100%, of local government elections. So if we push every state, no matter the policy we make at the federal level, it's the state that will put it to action. So let's push more on our governors to make the health sector work. That's where the action is. No matter what the money you put at the federal level, more of what we do in Abuja is speaking English. Policies, you cannot do policies without speaking grammar, you understand? So National Assembly too, they will move motion, they will pass resolutions. It will be hanging there in Abuja until the state assemblies, until the state ministries of health begin to translate those our beautiful national health policies that we make in Abuja to action in my village. It's not the president or the senator that will come to my village to make our primary health care to work. It's the supervisory councillor for health, that will push it to work. My councillor who is representing me, is my local government chairman. It's their actions and inactions. And of course, the governors that determine who the chairman will be, and commissioner for health and the head of the primary healthcare development agency. Is the actions at those levels that will translate anything we put into action. So yes, the National Assembly they will speak English because Parliament is meant to speak English. So they're also supposed to do oversight, but the oversight has to be more around the federal establishment, because that's the one that they have more power over. They can also do probe, but we know that even when National Assembly pass motions and resolutions, the executive many times ignore them. So More of the problem is actually with the executive arm of the government, both at the federal and the state levels, that it has to do with the legislature. But it's also the legislature that has the power to change the executive. So in many cases, they don't use those powers of either suspension or impeachment of the executive officers. Perhaps if the legislature begins to impeach people for not making our hospital to work, we begin to have more responsible persons at the executive level that will make our hospitals to work.
Thank you so much. Thank you so much, Doctor, for those wonderful submissions. We can't exhaust this conversation because we know discussion around Earth is very huge. It's not something we can discuss in a show. Perhaps we will look for other time when Doctor will oblige us his presence, his audience, to further discuss on Earth issue in the country. But before we go, Mr. Paul, in just 1 minute, what do you think is the way forward for Nigeria's sector, putting into consideration our president's visit, incessant visit to the United Kingdom for routine medical checkup?
Thank you, Michael. First of all, I think we should start with health education. I think there's so much that is missing in that area. And I think education generally, information, people needs to know that they even use it. Because it is possible for some of these facilities to even be there. What about using it? What about people who don't even know that they need to use it? What about people who don't even know that they need to press? That if you don't ask, you don't get, especially with the kind of leaders we have in across board in Nigeria. If people don't ask, they don't get. So I think we should do a lot, and I'm glad that Dr. Laz is working, seriously at the level of engaging the people at the top, and then sensitizing people. So that's what I think I would do if I have opportunity. I think I would want to even participate in recruiting people who would need to engage people who would need to. See, in India, there was a time that I went to carry out some activities in rural areas in India, and I found out that the structure that they have, it's up to the rural level. India has a form of government whereby everybody is powerful, whether at the president level, at the prime minister level, at the state level where you have the chief ministers. Then at the what we call local government, they have municipality. After municipality, they have what they call the zilla. That one is next to the local government, and then at the up to the very rural village. So everybody has their own power, and it trickles down. Everybody knows their rule. You cannot override my own rule. So I think this is something that, again, I'm talking about we copying and being somebody who grew up in the village. I also know that we have a system whereby the rural people can meet, and discuss issues that I remember that we used to do sanitation collectively in the village. We used to clear the road that leads to the farm, the major farm road to the farm. We clear it. The youth we gather maybe once in a month. Our stream. In those days where there was stream, people barely have a borehole in the village. So we went to the stream. We cleaned the stream collectively. So I think we need to go back to that level, so whereby people can really be educated about the need. In fact, there's a friend who is a graduate that I met. He's not a Nigerian, but he's an African, who told me that, see, Paul, you don't need when you go to hospital, they complicate your problem. That if you don't know, it is better. That is the kind of mentality that some people have. This is somebody that is educated illiterate. And I covered my face and I was wondering, how? Imagine you saying it is better for you not to know. They say if somebody say they say you have diabetes, it is better you don't know. If you don't know that you will live longer than when you know. You see, all these kind of things, all this kind of mentality, or I don't know what to call it, is something that needed to be corrected. So that's what I will focus on, especially listening to what Dr. Laz has said so far. Thank you.
Wow, thank you so much, Dr. Laz. We are just rounding up the show now, but we would love to hear from you finally. Resident doctors are on strike at the moment, and of course, is a very incessant one. The medical practitioners are always on strike. The JOSU, the NMA, and I mean the clusters of the medical industry. What do you think is a solution to this lingering crisis in the health sector?
Thank you very much. Yeah, thanks, Paul, furthermore, Paul, for that point on health education. It will help to sort out a lot of stuff. Yeah, what would make people going on strike? Strike is just a symptom of an underlying problem. So, how do you diagnose it? Health is not a priority. When the leadership in this country and followership in this country decide to make health a priority, perhaps that will mark the end of strike. Because if you have strong political will, in 2001, African heads of governments met in Abuja and made an agreement, made a declaration to say that not less than 15% of the annual budget should go to health. It is called Abuja Declaration of 2001. The highest proportion of the money the government of Nigeria at the federal level has allocated to health was 6% in 2012. So right now, since 2015, we've not had health budgets being up to 5%. So that's one part. But even as little as they are allocating to health, not all the allocated money is released, and not all the released ones are released on time. So if you make a budget, there's supposed to be quarterly release. So maybe if most of the releases came in the last quarter of the budget line, they will go and hurry to do konja kind of jobs and all those kind of stuff. So most of what is released is recurrent expenditure, payment of salaries, which the government is even struggling to pay now. One of the reasons for this strike is having many doctors not having received salaries for months, not just at the federal level, but at the state level. A doctor posted that in UCH Ibadan, where I trained, and my alma mater that I'm proud of, shamefully has not paid, over a third of their doctors since this year. So imagine we are in April. Some doctors have not received salaries since 2021. In Ondo State, for instance, since November last year, doctors have not been paid, except if they were paid within the last 2-3 days. But the agreement they reached on 29th of March with the Ondo Government Doctors Forum was that okay, they will pay December and January, and the other ones will have to wait later. You understand? So we're in April. People are still begging, going on strike to get December salary. In Abia State, it's over 20 months that the state government is owing health workers. In Imo State, it's up to 8 months. You understand? Across the country. And we are not just saying doctors are just the metaphor. Both nurses, medical lab scientists, other cadres or health workers are being owed salaries. We are not even talking of allowances and other payments that, according to National Association of Resident Doctors, there's been some they are owing since 2014. But like I said, these are symptoms. Even paying those salaries are not enough. Part of the demand is having good working conditions. If you are supposed to have 1 nurse to 4 patients. So if you have a general hospital of 36 beds, it means at any time T, you are supposed to have not less than 9 nurses on duty. So I know nurses run shifts. And they run 3 shifts. Every shift is 8 hours. So if a general hospital has 36 beds, they should have 9 times 3, not less than 27 nurses on their employment. running shift of 8 hours each. At any time you go, you should find 9 nurses. You understand? We are supposed to have one doctor to 600 population, not 600 patients, 600 population. So with 200 million people, we are supposed to have over 300,000 doctors. You understand? So we have probably less than 50,000, and they are jetting out every other day. Even some of us that left the country to do postgraduates and returned, at some point we started asking ourselves, why do we have to come back here? And there's serious pressure by our colleagues out there to leave this place, and because it's really frustrating, and it's not as if anybody wants to leave. The system essentially forced you out. Why is it doctors and nurses that are leaving? It's because it's like a universal degree. Anywhere you go, even if you don't understand the language, you can check somebody's temperature and run some tests and prescribe treatment. You understand? So when Nigeria says health is number one and have demonstrate political will to solve the problem, all these things will disappear. Until that happens, the strike and so many other crazy things, unfortunately, will continue to
Thank
happen.
you. Thank you. Doctor, we cannot thank you enough for
Michael,
these submissions. We are very
Michael,
grateful. Okay.
can I ask a question, please? I'm sorry.
All right. Okay. Okay. Okay.
I may not have opportunity to ask, and I really do think I should ask. Dr. Laz, you said some people have not been paid as much as 20 months.
Yes.
So how do they pay their bills? And the reason I'm asking you is this: I've lived in an environment where I know my salary for the month, okay, and I know that within that 30 days or 28 days, nothing else is coming. Addition is not coming from anywhere. No data. Nobody's going to come walk into my office and dash me money. In fact, there are some places where you cannot give tips. You understand? Where you cannot accept tips. So now you are basically dependent on how much you are earning. But I know that that does not really work in Nigeria because I worked there. But now I'm asking, being somebody that have been away for a while, how are people managing? How can I be working 1 month, 2 months, 3 months, 5 months, and you are not paying me and I'm still going? How? Please,
Nature,
help me.
nature abhors vacuum. Nature abhors vacuum. So these guys are civil servants employed by the state. So except you resign, you are still a worker of the state. But if they are not getting paid, they seek other ways of making money. Either where if they are supposed to spend 8 hours in the hospital, they decide to spend 1 hour and go elsewhere to make a living. Or if they are supposed to come 5 days in a week, they decide to go 1 or 2 days and go elsewhere to make a living. So, and who is suffering it? Is the patients who go there to seek health care. They will not see people that will attend to them. Or if they will attend to them, they charge them more they are supposed to be charged in the first place. So it gives room for a lot of crazy stuff, because people must survive. And it gives room for a lot of unethical practice, unprofessional conduct that we observe in this space. And it's difficult to hold anyone accountable when you are not paying the person. I really salute those, especially those resident doctors and house officers who are still going to work, because for me, if I work and I don't get paid, waking up to take my bath to go to work the next day, I usually find it difficult to convince myself. So even without declaring any strike, I may just, say that I'm indisposed to go to work. You understand? So I really salute those that work 1, 2, 3 months without getting paid and they still wake up to go to work.
Wow. Thank you so much. We cannot thank you enough, Doctor, for giving us opportunity to hear, to learn from you. We know how busy you are. I know. And we are not taking this opportunity for granted. But before we go, Doctor, we want to specifically congratulate you on your prestigious alumnus award from your alma mater. Of course, I am not surprised anyway, because you have always done us proud. And we hope that you continue to sustain the tempo. Dr. Laz is a Earth Policy and Management Sustainable Development Consultant consultant, founder, and CEO of Talk Health Real Media, and of course the convener of Make Our Hospital Work. Doctor, we want to specifically and specially thank you for the opportunity to hear from you. Dr. Lars joined us all the way from Abuja, that's the Federal Capital Territory of Nigeria. And I want to thank my brother and friend, Paul, all the way from Kerala. Yeah, I think I was correct. Kerala is a state in India. Thank you very much for this opportunity. I hope that when next we have opportunity to engage topical and actionable issues, we do well for the sake of Nigerians to actually engage the platform. Thank you so much, and bye for now. I am Olaogun Michael Sukomi by name.
Thank you.
Thank you.